I'm Liz Howard. I'm the Chief Clinical Officer for Flourish Care, and I've been a midwife for 35 years. I've been at Women and Infants as a midwife for 20 years, and we're really excited to reignite this series. We found that during the pandemic, families really needed information on how to navigate hospital systems through pregnancy as well as parenthood. And so we're really happy to bring to you Building Your Birth Team, Why You Need a Doula. I am so fascinated in how families get ready for parenthood to make that transition. And I always think about how in nature, birds really seek out diverse elements to build a nest, to make something that's both flexible and strong that weathers the elements. So I really want to talk to you about what different members of the birth team do and why having a doula really enhances the care that's provided to you during pregnancy, whether you're giving birth in the community, such as at home or in a birth center or in the hospital. So first, let's just do a little definition here. So what is a doula? A doula is a trained non-clinical professional based in the community who provides continuous education, physical and emotional support to birthing people and their families before, during, and after childbirth to help them achieve the healthiest, most satisfying experience possible. Birth is an experience that everyone should feel good about, should feel prepared for, and supported. And adding a doula to your birth team, whether or not you have the best nurse, the best physician, the best midwife, will enhance the care. I really believe in that. A study that was done back in 2001 in Women and Infants was actually one of the hospitals included in a randomized trial on nursing care, whether or not one-to-one nursing care was the same as continuous labor support. And what they found is that while one-to-one nursing care is optimal, it does not give you the same kind of support as a non-clinical support person providing you support in your pregnancy. And that's probably because nurses, just like midwives and physicians, we also have other tasks that are related to your physical care to focus on. So adding a doula, if you could go back, thank you. Adding in-person doula care will actually show you some incredibly robust outcomes. There's actually nothing better studied in obstetrics than doula care. It will lower the preterm birth rate. It will reduce the need for pain management. It does not mean you cannot choose pain management. You can have an epidural, but it does show in randomized trials that the need for pain, like such as morphine, epidurals, is reduced. There is an overall reduction in depression and anxiety. There is an increased rate of breastfeeding. There is a decrease in neonatal intensive care rates by 50%. And of course, most costly, it lowers the C-section rate by 30%. So lowers the cost to you, to the healthcare system, and to the public health system. It also is being shown to reduce birth inequities. So instances where families feel less heard in terms of their wants and needs, that disparity is reduced by hiring a doula. So there's lots of incredible evidence out there as to why a doula adds to your team. It's one of the many reasons why reimbursement is happening in many states at a rapid pace. And Rhode Island has, thanks to the Rhode Island Birth Worker Cooperative, has one of the most progressive doula reimbursement bills in the country and is a model for policy. So what I like to think of in terms of birth is that bundling your care, meaning that you're collecting a group of evidence-based strategies that, in terms of strategies that are known individually to work, but when you put them together, they're bundled to provide even better care. And to me, that value, quality, and equity bundle means including midwifery care as appropriate. I happen to think that at Women and Infants, we get to work with the best physician consultants and a world-class maternal fetal medicine team in terms of who we can consult with. So I feel very confident when you come to a midwife in my hospital that when you come outside our scope or when expert consultations is needed and complications, that we have access to incredible resources. Community education, there is nothing better than getting education both within and with outside your healthcare team to make sure that it's non-biased. We have lots of resources in the community for community education. Urban Perinatal Education Center is a great example. There's lots and lots of resources that we're going to share with you at the end of this, my particular talk. Doula support, once again, I'm going to provide resources on how to access a doula support and shared decision-making. We are in the process now of implementing a shared decision-making whiteboard at Women and Infants Hospital, teaching providers, starting with our residents, and it's thanks a lot of the work that Anna Sophia has done in our resident education program, how to talk to patients about their choices in a way that is equitable and allows for a lot of shared decision making. And that's a skill, and that's something that we're working on, as well as how to provide this information in a trauma sensitive way. We know that many families come to any healthcare experience with their own history of violence, with trauma, with not good experiences with the healthcare system. So those are ways in which we're trying to improve equity and value, is by teaching our newest providers, our residents, how to provide trauma-informed shared decision-making. So birth is emotional, and I love this slide, and I love this quote from Lenore Friedrich. They shouted and I shouted, not because of the pain, but because something elemental and stupendous was happening and I was in on it. The thing that I love about being at birth is just that emotion, that the relationships, the knowing that the birthing individual is bringing forth new life into the world. And that's why when we think about pain and coping in childbirth, it's different than other types of pain because it's something very natural and beautiful is coming forth out of the pain. So something that we use to assess pain in labor is a more holistic way called the coping with labor scale. So we're looking at the birthing individual, we're looking at, are they coping or are they not coping? So coping looks like rhythmic breathing. Coping looks like support. Coping looks like, it does look like noise, but it looks very different than when somebody is anxious and maybe wants, or in their birth plan, is to have not a pharmacologic support. So we have support for that too. We have epidurals, we have pain relief, we have nitrous oxide. So knowing what your coping strategies prior to birth are is a really important aspect of doula care, of really understanding what you are hoping for. If you are the type of person that has prepared for a marathon and you know that you can do that, birth is the same way, preparing for what it might feel like, what different experiences might look like, and then again, surrounding yourself with a team that understands your wishes and is there for you and present at every step of the way. And these are just some really nice pictures of what support looks like, what bonding might look like. And I love the picture in the lower right of, some really nice hands-on labor support techniques that probably taken away this person's back pain. So this is a quote from a book that I read in a sociology class in 1983 in my liberal arts college, that birth is not about making babies, it's about making mothers strong, confident, capable mothers who trust themselves and power in their inner strength. And this is by a sociologist named Barbara Katz-Rothman that wrote a book to me that changed my life called Women in Power in the Birthplace. And there are power dynamics in the birthplace, particularly if you give birth in a hospital. So having your support team around you helps you negotiate those power dynamics in a way that is best for you, in a way that honors your preferences, in a way that honors your family and honors that transition in the most sensitive, supportive way possible, so that you embark on your journey as a parent in a confident, calm way that makes you believe that you can do it, but also helps you know, what are my resources? What if I'm feeling overwhelmed? Who do I call? Who's on my team? And how do I make sure that this transition is as healthy and optimal as possible? It's like Anna Sophia said, dream for a joyful, beautiful transition to parenthood. So here are just a few resources from pregnancy to postpartum. I know Rhode Island Department of Health is really putting together something incredibly comprehensive for mental health resources, lactation, feeding, and nutrition. So we have a small group of resources here. Knowing your lactation, feeding, nutrition resources. If you're not in state, La Leche League is always a good resource. WIC is always a good resource. Birth worker and family visits. We have Flourish Care. We have the Rhode Island Birth Worker Co-op and the Family Visitor Program. Mental health resources are as listed here. Women and Infants has the oldest day hospital in the country. We actually are developing a new program that's going to start this fall for women with substance use disorders. We know that the number one cause of maternal mortality in Rhode Island and across the country are from mental health and substance use disorders in pregnancy. There are transportation resources here and insurance resources. So I wish you well on your journey. Please feel free to pop any questions in the chat. And I'm so glad to reinvigorate our virtual series. I know we all get a lot of joy out of this, of sharing information. I love birth, and I want yours to be joyful and positive. Thank you.